Hello guys, Assalamualaikum, and I'm going to start the Oxford Handbook of General Practice, edition 5. So let's start from the page number 19. Okay. So what is the general practice actually? So generalism describes a philosophy of practice which is person, not disease-centered, and continuous, not episodic, integrates biotechnical and biographical perspectives and views health as a resource for living and not an end in itself. Okay, and in the early 19th century, when apothecaries, physicians, and surgeons provided medical care, the term medical practitioner became applied to apothecaries, taking the membership examination of the Royal College of Surgeons of England. Over the past 60 years, general practice has established itself as the cornerstone of most national healthcare systems. In general, the better the primary care provision, the better the health of a population. So general practitioners, GPs or family physicians have shown the intellectual framework within which they operate in different forms, complementary to but no less demanding than that of specialists. So what is the medical journalism? So the Royal College of General Practitioners defines medical journalism as an approach to delivery of healthcare that routinely applies to both an holistic perspective to the patient's problems, and it involves seeing the person as a whole and in the context of his or family and wider social environment. Using this perspective as part of the clinical method and therapeutic approach of all clinical encounters, and being able to deal with undifferentiated illness and the widest range of patients and conditions in the context of general practice, taking continuity of responsibility for person's care across many disease episodes and over time, and corresponding care across both health and social care organizations. So the role of the GPs diagnose illness, treat minor illness in the community, promote better health, prevent health, diagnose and certify disease, and monitor chronic condition and refer patients requiring specialist services. And general practice is the primary access point to health services actually. So although patients have an average of more than 5 consultations with their GP every year in the UK, and only 1 in 20 consultants results in a secondary care referral. To do this, GPs must have a working knowledge of the whole breadth of medicine, maintain ongoing relationship with their patients. They are the only doctors to remain with their patient through sickness and health. So focus on patient's response to illness rather than the illness itself, and taking into account personality, family patterns and the effects of these on the presentation of symptoms. Be interested in the ecology of health and illness with communities and in the cultural determinants of health beliefs. Be able to draw on a wide range of resources including intuition, medical knowledge, communication skills, business skills, and humanity. And in addition to day-by-day medical care of their patients, GPs in the UK have a number of additional roles. Okay, like gatekeeping, navigating, service providing and improvement, research, education, and leadership. So in gatekeeping, GPs control access to hospital-based services enabling cost-effective care. In navigating, GPs work with patients and carers to give them effectively and safely through the healthcare system. And in service design and improvement, GPs manage service provision with their own practice and beyond their practice boundaries. In research, GPs need critical appraisal skills to understand and apply relevant evidence to inform clinical decision making, and they need to be competent in collecting and analyzing data for service improvement, and must collaborate effectively in primary care based research. In education, GPs can be effective teachers in a wide range of contexts, educating patient, practice staff, medical students, and junior doctors, fellow GPs, and the general public. And leadership, many GPs have leadership roles in their own practices within their localities or nationally. So here is the difference between GPs and a specialist. So what is the difference between GPs and a specialist? So Marshall Marinker constructed the role of a generalist and specialist as follows. GPs exclude the presence of serious illness, whereas a specialist confirm the presence of serious disease. GPs tolerate uncertainty, managing a patient with undifferentiated symptoms, whereas specialists reduce uncertainty, investigating until a diagnosis is reached. GPs explore a probability of seeing patients from population with a relatively low incidence of serious disease, whereas specialists explore possibility of being a pre-selected population of patients with a relatively high incidence of serious disease. And GPs marginalize danger, recognizing and acting on danger signs even when diagnosis is not certain, whereas specialists marginalize error, ensuring accurate diagnosis and treatment. So to perform their roles well, GPs must show empathy for their patients, engagement and commitment to involve themselves in every aspect of patient care, appreciation of the limits of their skills and expertise, and professionalism is their dealing with both patients and colleagues. And what is primary care? And primary care services provide the first point of contact in a healthcare system. In the UK, general practice is one of the primary care services. Others include community pharmacy, dental services, and optometry services. So, I will make another video on what is general practice actually. Okay, I hope it was helpful for you guys. Kindly subscribe my channel and support, and take care. See ya. Love is.